what do you think as far as like the future of federal employees in public health? Do you feel as though they should kind of stay strong, stick it out, or do you think it's time for maybe a pivot to the private sector?
I mean, pivot is my middle name, and the problem is you can't trust what's happening in the world right now.
Yeah.
Well, in America right now. So it's very difficult because, again, something else that has resonated throughout this series is that we have been conditioned to talk about, we've been conditioned in school that our next step is going to be a federal job.
Yep.
The goal is a federal job.
CDC,
NIH, that's what you're supposed to do immediately after. So my heart goes out to people who have been let down by these organizations that are, like law for us. And it's been very difficult to watch. But I think as far as the future, for those of you who have you have federal skill sets. I mean, you're the golden ticket. So, I mean, if there is no time, it's now for you to pivot and transfer those skills to consulting.
Oh, yeah.
The opportunities are there. You just have to transfer those skills that you've gained and use them. No one knows more than you do right now.
Welcome back to the Dr. Daz Show. And we are in the final episode of our 4-part Business of Public Health Summit Insider Series with Dr. Brittny James. We have been going strong, and if y'all have been with us for all 4 episodes, then you know we've been giving the tea, we've been giving just tips, strategies, everything that you can ask for to build an amazing and thriving business and to prepare you for the Business of Public Health Summit on April 11th. So by now, if you have not bought your tickets,
you tripping.
Big tripping. So make sure that you buy your tickets for this summit because this is an experience that you don't want to miss. And notice I said experience because it's going to be an experience.
And it's nothing like we're to the 4th series or 4th episode, and all of the content that we've described that's going to be within the summit is like nothing we have ever experienced. So it's like I think the theme of this series has just been giving what we didn't get.
Yes.
Made me feel tingly.
Yes, I love
It's like giving what we didn't get. And I think, and I give you your flowers all the time, but I think the Public Health Club is that. Like, it gives what we did not get. And I can't stress enough how grateful I know at least I am, but for what you've done for the community. It's so important and so needed. And I think the summit is going to be just that. This is not your big APHA. This is not your statewide conference. This is an opportunity for you to come and really be, shoulder to shoulder with people who can really guide you in the right direction. So for those of you who have been asking for that one-on-one mentorship, it won't be that, but you will have dedicated time to network and talk to other individuals who can put you on that right path. And if you are not part of the Public Health Club yet, you haven't quite committed, this will really show you what it's all about. So for those of you who are on the fence, the summit will really give you the kick you need to get in.
Oh, yeah. And a lot of times, you attend these conferences and they're so boring, they're stuffy.
Yeah.
Like, it's not going to be like that. Like,
and you're just a number.
You're just a number. And it's just so much going on. Like, no, like we have really curated this event to be, like you said, what we needed, what we wish we would have got, right? So from the entrepreneurship perspective, from even just career perspective as well, how to pivot in your career. And today, we're talking all about the future of public health, right? And talking about the workforce and just kind of where it's going and how can you really kind of find your space within public health and really just excel in your career. So just first question, Doc B, what do you see, like, I know right now we're in some trying times.
It's hard.
But what do you see as like the future for the public health workforce?
I mean, wow. I think we've seen it change so much in just the short time that we've been professionals in public health. And I mean, I think back to when I first started my education in health promotion in 2009. The 6 dimensions of well-being, we're at 9, 10 dimensions now. So just kind of watching that evolution over time has been very interesting, and even the shift of the nomenclature that we use, health promotion to now it's public health.
Yep.
So it's been a lot of changes that we have seen. Where are we going? It's very hard to tell right now. It's really cloudy, and I think that we were in a good place. Wrong wording. We were in a great place of growth and understanding of what public health was during COVID-19. That was our time to shine.
Yeah. That was when everybody thought about public health.
That was our time
or
to shine.
knew what public health was.
That was our time to shine. And I think that gave the broader community either a very positive understanding of public health or a very negative and confused and concerned view. So I think the future involves us reminding people the important and positive aspects of public health. So that could be going back to the basics of health promotion.
Yeah.
And just educating people about what prevention versus health maintenance is. Because I think we don't think about it enough. We're very reactive as an American culture.
Yeah, for sure.
So of course, a lot of the information, education we receive now is around chronic health conditions, but those are largely preventable. So I think the future of public health is really going back to the roots and talking about health prevention and health promotion versus reacting to issues as they arise.
Oh yeah, I agree with you. And I really do hope that we do start to prioritize that more, because I feel like, we live in this culture where, we want everything fast.
Yeah, and we want everything now.
Want it now, we want it fast. And what's crazy is so when we think about just like our health, and you mentioned chronic diseases, and I think that a lot of people like to kind of chase the vanity of it all. So we think about the BBLs.
Come on, talk about it.
The breast implants and all of that. And it was crazy. I actually seen this trend the other day when I was scrolling, and this girl, she was talking about how she got her breast implants out because of how all the problems that they cause. And what they don't tell you is that you got to get that done, like redone or whatever, or you're going to have some issues. You're going to start having issues in some years with having them in for so long. So it's not something that you can really maintain. And then if you do want to get them out, that's another $50,000 to say you want to get them out. And so it's just crazy that, we have this culture of wanting to do things quickly, get a BBL, get the whatever so quickly, instead of, doing the things that we know we should be doing.
Yeah, we know. And we know what works.
We know what works.
And I think this is a good time for us to talk about the impact of social media on public health.
Oh, girl.
Because I think that is where that has come from. As a 30-something-year-old woman, I think we have seen, again, that evolution. There was no Instagram when we were in our 20s or, in our teens. So we were not so early exposed to, I guess, what we think people like. You only had the girls to compare yourself with at school.
Yeah.
So I think we didn't have so much exposure to what else is out there.
Yeah.
And I think that makes a huge difference in terms of how men and women are viewing themselves and just the concept of, what other people want for you.
Yeah.
I think again, going back to the basics of self-esteem, it's self-esteem.
Yeah.
It can't be brought from someone else. So I think social media has been a detriment to the health of a lot of young people.
It has, and I think that it can be an amazing tool if used correctly.
Absolutely.
And I think that one problem that I see with public health that we don't do very well is communication.
Agree.
We don't do it very well. I think that we started doing it when COVID happened. We started kind of changing our strategies. That's when I seen CDC partnering with social media influencers, and I said,
y'all onto something.
Y'all trying to get in the game. But I haven't seen that as much. I see it a little bit here and there, but this is the thing, if we want to reach the people, we got to go to where the people are. Right? We're taught that. That's basic, in public health skills, we're taught that. And a lot of times, the people, they're on Instagram, they're on TikTok, scrolling mindlessly. That's where they are. And we do have to invest in thinking about health communication, investing in that and reaching them where they are. And I think that was my whole thing too with starting the public health club, because I couldn't find any public health influencers. I found medical doctor influencers.
Sure.
Plenty of them.
They're out there.
And I was just like, wow, this is a space where we need more people to speak up and to talk. It's public health. It's the public, right? We need more people to speak up, to talk about these things. But we didn't have it.
The problem there is that even when experts are involved in that communication process, you still got the comment section. And I think that is where we fall short as a people.
Yeah.
Because there are a lot of opinions, there are a lot of people in the comments who are providing false information.
Oh, yeah.
Or their own experience that is an anomaly, that does not support the research and the evidence-based information that we should be sharing. So with social media, misinformation is, I mean, right there. Just like information is at your fingertips, as well, misinformation is too. Oh, yeah. So I mean, I think that's kind of where we are in the culture. I mean, and we go to social media for news, like. ATL Scoop is my news source. Like, if I want to know where the traffic's at, I can check ATL Scoop versus watching the news. It's like, it's just, there's an entire paradigm shift in terms of where information comes from. And a lot of us get that from social media, but I mean, there's more misinformation than not there.
Yeah, that is true. That is so true. And like you said, the comment section, that was one thing, like with having a business that is driven, like I'm driving leads from social media, meaning that I have to do content marketing. I have to do the social media marketing. One of the biggest things that I had to kind of deal with was the comment section. And you know,
you be fine for your life in them comments. I ain't gonna hold you.
Listen, I done started turning the comments off now on certain
posts.
You've
been doing good.
I've been doing good. Like, but at first, I was tearing people up because y'all, people. But I was doing a little. I was nice, nasty. Though. I was nice with it.
But people be loud and wrong.
Loud and wrong, and it's like little simple things. Like, you know, I post a lot about going to college and how college benefited me. People argue with that, and that's when I tell people, like, all the time, like, you can be the best person in the world. You can be the sweetest little angel, and somebody will always have something to say about you.
You can't win with people.
You can't.
You can't win with people.
You
people
can't.
Are gonna. Some people gonna like it. Some people gonna hate it. And as my favorite saying is, everything ain't for everybody.
Oh yes.
And that is okay. So I mean, you know, anything you put out there, somebody's gonna have something to say.
Oh yeah, for sure. And girl, we got off on a tangent.
Yeah.
So
important. Be mindful of what you're intaking.
Yes, be mindful of that, and think about how we can utilize it for public health. Right. Yeah. Think about how we can really utilize social media. We can utilize all this stuff to continue to provide information, because, you know, if you're thinking about creating a business, you don't only have to do a consulting business. We need people that are doing the social media part, right?
Absolutely.
That are doing the content creation as far as public health is concerned. You making your own public health agency, focus in on health communications, and you focus in on social media health communications, right? That's a whole business idea and a whole thing that is needed. But I think that, you know, thinking about like just career, going back to like career. So as far as like the future of public health. Now with these, like, you know, executive orders that have been coming out and all of these things, the firing, and now like I've been seeing people are getting rehired back into the federal government. What do you think as far as like the future of federal employees in public health? Do you feel as though they should kind of stay strong, stick it out, or do you think it's time for maybe a pivot to the private sector?
I mean, pivot is my middle name. And the problem is you can't trust what's happening in the world right now. Well, in America right now. So it's very difficult because, again, something else that has resonated throughout this series is that we have been conditioned to talk about, we've been conditioned in school that our next step is going to be a federal job. The goal is a federal job.
CDC,
NIH, you know, that's what you're supposed to do immediately after. So my heart goes out to people who have been let down by these organizations that are, you know, like law for us. And it's been very difficult to watch. But I think as far as the future, for those of you who have you have federal skill sets. I mean, you're the golden ticket. So, I mean, if there is no time, it's now for you to pivot and transfer those skills to consulting.
Oh, yeah.
The opportunities are there. You just have to transfer those skills that you've gained and use them. No one knows more than you do right now.
Oh, yeah, for sure. And everybody wants a little piece of the money from CDC, right? Especially like all of these, like, you know, private companies, these other like these other consulting agencies, these large management consulting firms. You know, you think about like the big four, those consulting firms like Accenture, Deloitte. Like, so you're thinking about KPMG, so like all of these, like they have public health sectors or somewhat public health adjacent type sectors that you can transition and pivot your skills into, because when I look at those job descriptions, a lot of times what they say is they want someone who has federal experience or federal knowledge.
Absolutely.
And they will probably pay you top dollar for that federal knowledge. So I want to make sure that all of people who are listening to this who are federal employees, you know that you do have options.
Absolutely.
Like you have a lot of options, whether it is building your own consulting business and starting that way, whether it is working for some of the large management and consulting firms, whether it is pivoting into tech industry, because one of the things, if you're in the public health club, then you may have attended that public health and tech workshop that we did. And within that one, we had a lot of amazing panelists who work for tech companies who do public health roles. And, here's a tip. You don't have to have a tech certification or any type of other certification to pivot your public health skills. Sure. There's things like not patient engagement, but there's things like user experience research, where we can utilize our research skills, right?
Evaluation skills.
They even want community engagement, right? They want people who understand the community and who they want to buy their products. So they want you to come in and help them with engaging a community. We know that like the back of our hands, right? So that is something that, you want to make sure that you're always thinking about, like, how can I take my skills and really pivot it? And I know, Doc B, that's something definitely me and you are going to be diving into in the summit, right?
Oh, yeah. I'm looking forward to our panel because I know we get a lot of questions about how did you end up here? And it's not happenstance. I think both of us have a very unique path to where we are today, and it's been all about transferring our skills.
Yeah.
So I pick up an experience, say bye to them, because that job will still be there. Every place I ever worked for is still open. They were fine when I left. So I think that's important to know too. We get so comfortable in the work that we do, and within public health, I know we're enamored with the work that we do. We're passionate about the work that we do, but somebody else can do it. Someone else can do it. So, I really have taken those skills. Like I gave the example in our last episode about I worked for UNCF. COVID took that job from underneath me, but now I contract for them from time to time, and I make more money in those 3 or 4 months than I ever did when I was working for them. And it's all about relationship building, picking up skills, knowing that organization's language, and the context for the work that they need to be done. So I think, take the experience and move on. So again, going back to those federal employees that are having a hard time or not sure how to quite pivot yet, I mean, just sit down and think about some of the skills that you've gained, some of the knowledge that you have that is unique to Fed life. Everybody doesn't know that. So when you're composing these cover letters and working on your resume, be sure to show that value add, because no one else has it. I can't do federal work. I don't know it. Now, a small component of it, sure, but I can't do what you do.
Oh yeah, definitely. And I think that, one important thing to note, since we're talking about, of course, like, pivoting, and we're talking about business and building your own, whether it's a consulting firm or just whatever it may be. One quote that I was listening to actually on the way over here, I was listening to a podcast, and y'all know I'm a podcast, like I'm heavy on the podcast. Junkie. I'm a podcast junkie for sure. But they were talking about just like business strategies, and there's actually an episode they were talking about what they learned from quotes from Jay-Z.
Oh, wow.
Business.
I love that.
Yeah.
I love that.
But one of the things they were talking about, is if one door closes, like, hey, go break the wall down and build your own door.
Yeah.
Like, go build your own table. They won't let you at the table. Go build your own table, right? And I think that that's one of the things that I took and I ran with, because it's ironic. And I was thinking about it one day, and I don't think I ever mentioned it out loud, but the organization that gave me my first consulting contract, I had probably like a year prior, I had applied for a job with that organization. Got all the way to the final interview, right? Get to the final interview with the person who would have been my boss. And one of her remarks that she made about me was that I was young. She was like, you're very young. And I was like, yeah, but I've done this. I got to the final interview, so clearly I'm good, right? So she didn't end up going with me. She ended up going with somebody else. But the work that they contracted me to do was basically the same work that I would have been doing in that job.
And for how much less?
Way less hours. Way more money, way less hours. And I'm not committed to them. I can go and pivot somewhere else super quickly with getting another consulting contract. But that's just to say that one no does not count you out from anything.
Correct.
It's that willpower that you got to have to keep going, to keep trying to pivot, to keep trying to figure it out. And shoot, like I said, bring your own table, build your own table, get in there and start knocking things down, because you know, a lot of times, like, we wait for things to be handed to us.
Yeah.
We wait for, like, a job opportunity to come. We wait for all of these things to come. We wait for that promotion. We wait for whatever that may or may not come. We put our fate into somebody else's hands when you can just get out there and go build it, go do it. And granted, like, I know I make it sound like it's easy, and it's not. We talked about that. It's a lot. But if you have that little bit of delusion that we talked about in that first episode, that little bit of delusion that you may have, you can do it. You can do it. And then you surround yourself with the right people. Yeah. Like, you are the sum of the 5 people you hang around with the most. And whether that is you listening to these podcasts all the time, like I do, to get my mindset right. Or, you know, you're getting in the public health club and you're listening to these workshops and you're getting around people who are building their companies from the ground, who are, you know, in leadership positions with, you know, CDC and with all of these amazing organizations, consulting firms, nonprofits. Like, you know, we have talks and chats with all of them. We talk about their career. You literally have a direct path to ask them all the questions. And that is the key to success, I feel like. Being able to really get that exposure and just get everything that you need to really just thrive, right?
I think, wow. I mean, these four episodes have been great. If you're just tuning in for the first time, definitely go back and watch, because I think we've done a beautiful job of really showing from start to finish, you know, it gets scary, but you can jump in there and thrive. And we don't talk about it, and we don't come from a generation of business owners or people who took a chance. You know, I mentioned in the first episode that my mom worked in public health, and she retired from her role in public health, but I mean, she was an administrative assistant for like 30 years. Can you imagine working for somebody for 30 years?
Oh my gosh.
And I was happy for her, but I just learned from that moment, like, Britt, you can do so much more than just work for somebody for a long time. That's not our goal. And I think, you know, I know you mentioned in episode 1 how you endeavored to serve hundreds and thousands of people. And if you can just stick to that goal and figure out the way to do that, you're doing it.
Yeah.
You got hundreds of people in the public health club. So I think if you can see the bigger picture and just stay the course, you'll get there.
And realize it's okay. It's more than one way to get to your goal, right? Like, even if, you know, your goal can change a million times, but are your strategies to get to that goal can change a million times. But if I have the goal, like you said, of serving hundreds and thousands of people, I didn't know how that would look when I started. Like,
and it can change.
It has changed. It's looked so different at every stage in my life. Like, right? But at the end of the day, at the core of it all, I've been able to help people.
Absolutely.
I've been able to help get them to that next level. I've been able to help, you know, build chronic disease prevention programs. Like, and people are sending in testimonies about how they're managing their blood pressure now. Like, I've been able to help people get 6-figure jobs, help people land 6-figure contracts, like doing all of these things. And I'm like, wow, you know, I'm passionate about this. I love this. But here's the thing too. I also deserve to get paid for what I do. I deserve to make the money that I need to make, right?
Absolutely.
Like, and it's okay to want to make impact and income. And that's listen, impact and income.
You can do two things.
You can do 2 things. You can. And I think that is the big takeaway that I really want people to have from the summit that we have. That making an impact is amazing, but I also want you to make that money. Okay?
So, I mean, let's get into it. So, Public Health Summit is April 11th right here in Atlanta, Georgia at actually my business's headquartered spot, which is the Gathering Spot. Beautiful event place.
A lot of parking for my Atlanta folks.
Free parking. Free parking. Plenty of parking. So please come. We are going to have panels. So we have some experts that are going to be talking about not just building your business, but pivoting in your business. Tech. We have 2 giants in the public health tech consulting that are going to be there to talk to you about how they got into their field and how they're thriving and how you too can thrive. And then, of course, we have the pitch competition as well as networking. And then on Saturday, we're going to brunch. So if you have not yet got your tickets, make sure that you add on that brunch. We'll be at Jove Caribbean Kitchen and Bar. It is a Black woman-owned restaurant here in Atlanta, one of my favorite places, and I know good food, y'all, so you can trust it. So your food will be good, vibes will be there. We're really looking forward to that, and that is an intimate experience. We only have 50 tickets for brunch, and we will not be adding additional tickets.
Yes.
So be sure that if you're thinking about being here on Saturday, or if you are an ATL native and you have a free Saturday afternoon, be sure to come out and join us for brunch and mimosas. Get some shoulder to shoulder time with some of our panelists and guests.
Oh yes, and at the summit too, we didn't even mention y'all getting a little champagne.
Oh yes,
some little hors d'oeuvres.
I heard there's cash
bites.
prizes too.
Oh yeah. Cool. Business pitch competition.
I heard it's
cash prizes.
Cash.
Okay, you can win.
Cash.
You can win some money. Walk away with a little something in your pocket.
Little change.
Yes, so it's gonna be an amazing time. And listen, me and Doc B, and just all of our panelists, we can't wait to hang out with y'all, interact, to network, right? That's gonna be a big deal. I know for me, being in the public health club, I talk with y'all virtually all the time. Y'all not only hit me up on the club, y'all literally be in my DMs on Instagram. Hey, I don't remember the club that days. I got a quick question.
Right.
And then I'm like, why you ask me in the club? But all right, what's up?
What is it?
But I get that all the time, and I know that some people that I know that do that all the time have already bought their tickets, and I can't wait to meet y'all. I can't wait for us to snap it up, get some pictures together, and just hang out and really have a great time and just rubbing elbows and getting to know the public health professionals in the Atlanta community, and really just coming together as a community, because that's what it's all about.
Yeah, really looking forward to it. If you haven't gotten your tickets yet, get them today. They are selling fast, and it is not unlimited.
It is not unlimited.
There is a cap.
Yes, there is a cap
be
on
sure
tickets.
That if you have not purchased your tickets, please do so. We can't wait to meet you. We have seen you virtually in the club for over a year now?
Yeah, over a year.
Over a year?
Mm-hmm.
Okay, virtually in the club over the year. So we want to see you in the spot now.
Yes. Well, all right, guys, this is going to wrap up our Business of Public Health Summit Insider Series. I hope that you guys enjoyed this.
I'm sad it's over.
Me too. This was fun. We got to do it again. So y'all let us know if y'all want another little duo tag team between me and Doc B.
Yeah, we can see what we can do.
Yeah, we can see that. So let us know in the comments if y'all want that. We're gonna find a way to make that happen if that's what y'all want, what the people want. We got to give y'all what y'all want.
We give the people what they want every time.
Yeah. All right, guys. We will see y'all April 11th. Make sure you come on time, all right? Because we start on time.
On time,
okay?
All right, bye.
All right, bye, guys.